What are the signs of child malnutrition and what should parents and guardians look out for? What causes child malnutrition and what are the consequences of malnutrition on children? Hello and welcome. I'm your host, Dr. Musamto Mene. Signing with us today is Trifosa Ntolewe. Globally, in 2020, 149 million children under 5 were estimated to be stunted, which is too short for their age. 45 million of those were estimated to be wasted, which is too thin of the height that they should be having. Now, 38.9 million were overweight or obese. Now, around 45% of deaths amongst children under 5 years of age are linked to undernutrition. On Vital Signs, we'll put the spotlight on malnutrition today with our special focus on children. Coming up on the program, we'll listen to a story of a Cape Town and rural Eastern Cape mothers working with the Pilani community health workers or mentor mothers in raising healthy children, and we'll also listen to an informative story about stunting. We'll speak to a pediatrician about the impact of malnutrition in children. We'll also speak to a pediatric dietitian from the Chris Hani Baragwanath Academic Hospital about the importance of nutritious food for children and which nutritious food to give to your child. Lastly, we'll speak to Assistant Director in the Directorate of Child, Youth and School Health at the National Department of Health and Save the Children South Africa's Health and Nutrition Thematic Manager about South Africa's burden of child malnutrition. Remember that you can be a part of the show today by asking the guests that we'll have on any question that you may have on your mind. Simply share your view with us on what we're discussing. The number to call is 011-714-0677, 011-714-0678. We're also available on social media, on Twitter at SABC Vital Signs or Facebook, SABC Vital Signs. The show continues after the break. Stay with us. Welcome back to Vital Signs. Now, South Africa has a double burden of malnutrition. 1 in 4 children, that's 27%, under the age of 5 is stunted. Now, in contrast, 1 in 8 is overweight. Now, severe acute malnutrition is one of the 3 leading causes of child death, and the number of stunted and overweight children is increasing. Pilani is an organization that is committed to improving maternal and child health care through a home-based program. Let's listen to the story of Cape Town and rural Eastern Cape mothers working with Pilani community health workers or mentor mothers in raising healthy children.
Maternal and child health is a serious concern in South Africa. 1 in every 5 babies die in the country before they even reach their 5th birthday, and almost 30% of pregnant mothers are HIV positive. Pilani is an organization committed to addressing the health needs of mothers and children. Their flagship program is a home-based outreach program where community health workers or mentor mothers go from house to house identifying pregnant mothers and malnourished children. Based in Cape Town and rural Eastern Cape, they assist almost 6,000 cases every year.
And in most of the time, those families, we discharge them with good outcomes. Children become rehabilitated and they go back to school, and mothers give birth to healthy children and they continue to sustain that.
This mother gave birth to premature and severely underweight twins. She didn't know how to care for them until a Pilani mentor mother took her under her wing. Malnourishment is one of the main causes of mental and physical disability amongst children in South Africa. Mentor mothers educate pregnant women on how to raise healthy children. One of the reasons for the success of the program is the way mentor mothers are selected from the community. Doctors and nurses in clinics aren't always able to understand a patient's situation at home or the language they speak, but these mentor mothers are all from the areas where their patients live and have themselves raised healthy children under the same conditions.
So you empower somebody who is in this community, who understands all the dynamics of this community and who is able to relate and who has experienced this herself. And then that person then comes back with knowledge and shares her knowledge and also her own coping skills.
By giving mothers vital education and support, they hope to ensure a healthier generation of children.
I am this mother now who has this lovely boy and he's healthy because of her.
Ndiziva ndirayithi ebomini bam xa uphila nekhona. Ndiyavuya ebomini bam. Ndiziva ndirayithi ndingumama orayithi ngoku. Ndinje. Yabo.
After the break, we'll speak to Dr. Ntlakanipho Mangeni, a pediatrician from the Chris Hani Baragwanath Academic Hospital, about the impact of malnutrition in children. Stay with us. Welcome back to Vital Science. Namhlanje sikhuluma ngesifo sendlala ebantwaneni and siyazi ukuthi ke inkinga enkulu esithola la eSouth Africa. Now, the COVID-19 pandemic came with a rising unemployment and food prices that were driving a dramatic increase in child hunger and, of course, disrupting children's access to essential safety nets such as school feeding schemes, early childhood development programs, and health services. Now, food prices rose dramatically before, during, as well as post-lockdown, with the Pietermaritzburg Economic Justice and Dignity Project reporting at 14.4% annual increase in the cost of basic household food basket in November 2020. Now, 3 million jobs were lost between February and June 2020, with women accounting for 60% of the jobs lost during the first wave. Now, to educate us about malnutrition in children, we're joined by Dr. Ntlakanipho Mangeni, a pediatrician from the Chris Hani Baragwanath Academic Hospital. Thank you so much for joining us, Doc.
Thank you, Musa. How are you?
Very well, thank you. So today we're talking about malnutrition, but I think it's a topic that requires a little bit of digging into. So when someone says a child is malnourished, what does that actually mean?
Okay, so the term malnourished, it means it's abnormal nutrition.
Okay.
So usually we use it in a context of undernutrition and most of the time. But it doesn't necessarily mean undernutrition only, but overnutrition. So when we speak about undernutrition, back in the days we used to use the terms like kwashiorkor, marasmus. So what you've explained earlier on, marasmic children are those who are stunted, meaning they are wasted compared to their height. And then the kwashiorkor ones are the ones with who look like they are fat, but instead they are actually starving in the land of plenty. And then when we talk about overnutrition, it's when we talk about overweight and also things like obesity, which we're seeing that it's also becoming a problem in our country.
So, I mean, you know, whenever you speak about malnutrition or children that are starving or children that just have bad nourishment, I guess, in that sense, it's always thought of to be this problem of very skinny, sick-looking children, and that would be that. But from what you're describing, it's naturally not that. It includes a child that's overweight. What do you think is contributing to this rise of overweight or obese children, but also to, I mean, I guess all the factors that I've mentioned, to this rise in children that are stunted and wasted?
Okay, so starting with the children that are stunted and those who are underweight for their age, mostly it's food security, and also it's also about how we educate people about what is a nutritious food. So you will find that, as you have explained earlier on, about the prices of food in the market that are out there. So you will find that, you know, a staple diet in a household is mainly carbohydrate. People are not supplementing with proteins and are not giving enough fat to the kids. So that also will contribute to undernutrition, where you find that the child is undernourished. And also the effect of not breastfeeding, we have seen that it has actually impacted a lot in our generation, because at least with patients or with babies that are breastfed, you can actually make sure that while they're still under 6 months, they'll be able to get proper nutrition for the time which is adequate for their growth and also their nourishment. Whereas when you come with bottle feeding and all those things, I'm not trying to say formula feeding is bad. It is good for those who can afford it and those who have easy access and those who can actually do it properly. But what we find is that with formula feeding some of the children, you tend that maybe because of food insecurity, mom will under-dilute the milk so that it lasts a bit longer. So that will add into malnutrition. And also preparing it. You prepare it, you go to work, you leave it out there, and it gets some bacteria. And at the end of the day, children who drink that milk will come in with diseases like acute diarrhea and so forth. Coming back to the issue of overnutrition, I think what is overnutrition when it comes to obesity and overweight, it is a disease of a lifestyle, we might say. Also by giving kids, every street corner there is a restaurant and whatsoever. So fast food and the way that we have channeled ourselves, living the kind of different lifestyle, where now the staple diet is mom has gone to work, she comes back, pick up a takeaway quickly, we go home. So recreational foods with lots of sugars, fat and all those things will actually lead to a child having overweight or becoming obese.
Now, apart from what an obese child would look like, what do children that are stunted or children that are wasted, that are sort of suffering from severe acute malnutrition, what do they look like? So as a parent, for instance, if you're at home and you're looking at this child, what does general presentation look like for you guys at the hospitals when you see these children?
All right. So those ones who are stunted, it's quite easy to describe them because they're quite thin. So compared to their weight, they'll be very thin and there'll be a loss of muscle bulk. So there's a test that we usually do. We say it's a mid-upper arm circumference. If it's less than 11.5 centimeters, that child is described as severely acute malnourished. And then with them, they're usually miserable. They look irritable. But the nice thing with them, when you give them food, they eat. And then the other ones will be what we used to describe them as kwashiorkor. So basically, they look like they are well off, but instead it's because of the, I would say it's the fluid in their body that is within the tissues. And what you find is that when you put your fingers maybe on the legs or on the ankles, we call it pitting edema. So there is like a dip that goes in and it doesn't come back out very quickly. So those are the kids that you will say they've got kwashiorkor. So sparse hair or light-colored hair. They will also have what we call angular cheilitis, like sores at the corners of their mouth. They can have oral sores as well. They can have problems with their eyesight, and they can have ulcerations in their eyes, in their cornea. And the other thing is they easily get infections. And those ones with kwashiorkor mostly are the ones that they don't want to do anything. They're quite lethargic. Even when you give them food, they don't want to eat. So those are the other things that you can pick up with your kid. And yeah.
How prevalent are these conditions in South Africa? Are these, when you speak of kwashiorkor, the image is always of, an African child who's got flies on their face. That very typical, stereotypical, very terrible sort of idea. But how typical is this in South Africa? How prevalent?
It is quite prevalent because I would say with every admission that we have at Chris Hani Baragwanath Hospital, there will be at least 1 or 3 patients that are coming in. It has been, and remember, Chris Hani Baragwanath is a tertiary hospital, so we're only seeing the tip of the iceberg. So when you go down to the secondary levels and the primary levels hospital, the burden is quite high because we only see like maybe a third of those patients because those are the ones who are now presenting with complications and they are referred to a tertiary center. So if you look at the numbers, it is quite large. Yeah.
In terms of treating children that have these conditions, how easy is it, and do you ever get the child to go back to normal? Do they ever go back to what their age mates or friends would look like and be?
Sure. So, Dr. Musa, what I would like is to say first, prevention is better than cure.
Good.
But however, saying that, so once we encounter those children, remember at Baragwanath Hospital, we're seeing the sickest of the most. So what we usually do is, yes, they are treatable, But the main important thing is that it's a multidisciplinary approach.
Okay.
A doctor is there as a pediatrician who assists. We need a nutritionist. We need a dietitian more than anything. We need also nurses who are going to be there to make sure that they give the food. Because remember, in Chris Hani, patients, mothers don't sleep there. So at night, there should be someone who's going to give treatment and also nutrition. And the main important thing is also to monitor the vital signs, because they're quite prone into things like they can drop their temperatures very quickly, they can lose their glucose, you find that they've got low blood sugar levels. So we need constant monitoring. It is a hard thing to do, but it is doable. We win with most of them, but we do lose some of them. So that is why I said in the beginning, prevention is better than cure.
Well, thank you so much for coming to the show to talk to us about malnutrition today. I think an important topic that a lot of people at home need to be aware of. It may not be your child, but living in the communities that we do live in, it's important to look out for children that may have such problems. And of course, be able to assist our neighbors and friends and family members if they have children that suffer from the severe acute malnutrition. That was Dr. Nhlakanipho Mangieni, a pediatrician from the Chris Hani Baragwanath Academic Hospital. After the break, we'll listen to an informative story about stunting. And then, of course, we'll speak to Monique Hall, a pediatric dietitian at the Chris Hani Baragwanath Academic Hospital, about the importance of nutritious food for children, and which food is nutritious, and of course what to give your child, because they need all the nutrients in their body so that they can grow and develop and reach their full mental and physical potential. Stay with us. Welcome back to Vital Signs. Now, across the world, as COVID-19 has affected every household and community, health systems and many other systems, of course, have been affected. And of course, you needed to have been adequately prepared for this devastating impact. Now, South Africa is no exception. Millions of children have been left vulnerable, exposed and unable to receive the healthcare and nutrition that they need to survive and thrive. Now, you can put the blame on many things, but you can't put the blame squarely on COVID-19, as malnutrition in children is not something new. Let's welcome Monique Hall, who is a pediatric dietitian at the Chris Hani Baragwanath Academic Hospital. But before we delve deeper into our discussion with her, let's watch this very informative story about stunting.
The first 2 years of a child's life is an opportunity to lay down the foundation for their future academic success, health, and general well-being. It's an exciting time, but it's also a time of vulnerability to stunting.
Stunting ke bolwetse bo le re bo ama gore ngwana a godishwa botse and bo mo ama mo tlhaloganyong le go goleng ga gage a kere go se fepe ga botse ga ngwana a kere
One in 4 of South Africa's children are stunted, and this can unjustly rob them from becoming the best they can be. Stunted children on average perform worse at school than their non-stunted counterpart. They are at a higher risk of developing diseases like diabetes or hypertension, and they are vulnerable to being trapped in intergenerational cycles of poverty.
The Grow Great campaign is galvanizing South Africans towards a stunting-free future. Using data to mobilize policymakers, stories to inspire the public, mom and baby classes to support parents, and communities of practice to empower practitioners. Together, we can stop the silent epidemic and bring stunting down to zero.
Most South Africans are not reaching their full potential. That is why it is important that we address the issue of nutrition to overcome stunting, especially in an environment where South Africa traditionally used to depend on unskilled labor. If we do not invest in nutrition to overcome stunting, we are really denying and therefore negating all our developmental work. Therefore, investing in a stunting-free South Africa should be everybody's business.
Encourage mothers to exclusively breastfeed for 6 months or for as long as they're able to. Also protect their rights to breastfeed in homes, communities, and the workplace.
Demand a safe environment with access to clean water and sanitation that enables us to raise healthy children.
I'm growing greatness.
I'm growing greatness.
I am growing greatness.
I'm growing greatness.
I am growing greatness. You
To continue our discussion on malnutrition, Monique Hall joins us, and she's a pediatric dietitian at the Chris Hani Baragwanath Academic Hospital. So, malnutrition, a topic that has been around for ages, yet we still find ourselves with the same problem where these children are either under or overnourished. But as a dietitian, how and what perspective do you take when dealing with undernourished children?
Okay, so what we need to remember is that many factors lead towards undernutrition. I think it's very easy to place blame at one area and say that's the problem. With undernourished children, we always want to remember that it is a family approach. Both mom and child need the support to get an undernourished child back to its full potential, especially once they've been discharged from home. So really the hospital services to get these children, and the clinic services to get these children back onto their feet, eating well, promoting good eating habits is really, really important. And then to remember to support that mother for a long time coming as well.
Now, education is obviously an important part because the children do get to the hospitals, whether a primary hospital, regional, whatever it might be, because of this nutritional issue that was there. But discharging them out to the same environment is obviously problematic. So in terms of nutrition, what skills and tricks and things such as that you teach the mothers about nutrition?
Okay, so I think a lot of mothers think that it's just avoiding certain foods or adding certain foods that will help. But really what we need to remember with any healthy child's oral intake is that it needs to be a balanced diet. Not one food group will lead to success, right? It needs to be the combination of all. When I talk about food groups, what I'm talking about is your protein-containing foods, which can be either plant-based or from the animal source. Plant-based ones being like your beans, your lentils, your soya, your peanut butter even, and then your animal ones, the ones we more commonly know, your chicken, your fish, your beef, your pork, as well as your dairy products. And then if we look at the other two food groups, we need to have our mineral and vitamins from our fibers from our fruits and our vegetables, which are very important. And then of course our energy containing foods, which come from our starches and our fats. All of these are important to combat malnutrition. If any one of these is lacking, a child is at risk of getting malnutrition, be it micronutrient malnutrition, where like vitamins and minerals are a problem, or underweight, SAM, like severe acutely malnourished, or MAM, moderately acutely malnourished. So all of them need to be in the diet.
So, I mean, you've identified that there are a number of issues that obviously contribute to a child presenting in a hospital or being severely malnourished. And these issues, a lot of the time, live in the socio-economic realm of things, where parents just can't afford to go buy the chicken, to buy the fish and things such as that. So what does a typical plate for a child that we don't want to suffer from malnutrition look like? What would that plate look like to someone who's got difficult financial means?
Okay, so I think maybe to start off with, your 6 to 12 month child will have completely different plate ideas than, for example, your 1 to 6 year old.
Okay.
And let's focus on the 1 to 6 year old because they should technically already have a complete plate. If we're looking at the plate model, we always want to make sure that each one of the foods is represented, right?
Okay.
If we are maybe in a more resource constrained setting, buying chicken, buying the fishes, that can be difficult. Beans are a wonderful, wonderful substitute.
Okay.
So having a protein source of your beans, your lentils, they can come in the tin form. The dried form is better that you can just rehydrate again and cook maybe in form of a soup, gravy, any sort of way to make it easier for the child to swallow and take in. Then we always want to include our starch as well. That can be our staple, pap, we see that a lot. It can be rice, it can be your pastas as well. And then we also do want to focus on vegetables. Vegetables, a lot of moms come to me and say, I can't afford variety. I can't have the potatoes with the butternuts as well as the spinach on the plate. But having at least one type of vegetable, even if it is the same 3 days in a row, 4 days in a row, is not a problem because it still gives you good fiber and minerals and vitamins. So that is my advice to moms. Try and maximize your budget by going for bundle deals, buying bulk, freezing, storing, curing and drying in order to keep food longer so that you can get that deal on a good bundle deal. And then not shying away from your plant-based proteins especially. Even having a little bit of peanut butter in your porridge in the morning is a good source of protein, and enriching your food with both a fat and a protein source that comes from peanut butter. Adding milk powders to foods or your oils or your butters to foods, especially in kids who are undernourished, might be a little bit different for overnourished, Jill, but for undernourished especially, enriching foods to make every bite as nutrient dense as possible is also another way to combat this.
Now, we've spoken about this age group 1 to 6, which as you've said, are children that should be eating the family diet. So whatever mom or dad has cooked, that's the food that they should be eating. But the issue comes sometimes with these kiddies that are between 0 and a year old that have to have milk in their diet. So this concept of mixed feeding then comes around. Can you explain what mixed feeding is and why it's such a problem to some groups?
Sure. Like we've heard before, we want to exclusively breastfeed for 0 to 6 months. This is especially important in moms who are HIV exposed or who are exposing their child to HIV. So what we want to avoid is mother-to-child transmission of HIV. Breastfeeding, according to the HWO, is completely safe to do if the mother is on lifelong ART or antiretroviral treatment. So where it becomes an issue for moms who are HIV positive breastfeeding their children, if we are mixed feeding, and with mixed feeding we mean adding any sort of extra fluids such as formula or food to the infant's diet before age 6 months. This can cause, or this increases the risk of the transmission of the HIV virus from the mother to the child. And that is why it's not recommended in HIV positive moms. We know that also early introduction to complementary feeding is not a good idea because the guts or the child's gut is not yet ready for food. And that's why it's recommended even for non-HIV exposed infants to only get complementary foods at 6 months of age. Breastfeeding is more than enough to cover all the nutrients until that age.
For children, is supplementation good? So taking actual supplements and vitamins and things such as that. Should parents go out of the way to find these supplements to give to the children if the child is termed normal and doesn't have any problems?
So no, your food, if you have a good balanced diet, including all the food groups like I've mentioned already, there should not be a need for any parents to buy extra supplement. Maybe that's also a good money saver. We get easily tricked into marketing campaigns where we think we need to add these to the child's diet. But if it's not prescribed by your doctor or by your clinic nurses, I would never add an unnecessary supplement to your child's diet and rather focus on giving good nutritious food.
Speaking, and of course flipping this now, speak about overnutrition. This is increasingly becoming a problem in South Africa and I guess in developing worlds as well, because fast food is readily available, exercise is no longer a thing that children will generally get into unless they're forced to do something. How do you manage a child's diet in terms of them being overweight or overnutrition?
Okay, that's a very good question because you are right. It's becoming more and more of a problem. I think the one thing I always start off with is telling them that it's a family lifestyle change. Right? I hate to say diet because it's so limiting. So a family lifestyle change, it really involves the parents. Like you already said, it needs to be exercise, it needs to be healthy foods in the home. It's really hard to tell a 5-year-old, you're not allowed to eat the chocolate, but I'm going to be eating the chocolate, right? So eliminating unhealthy foods from your immediate environment would be my advice. The other thing is we want to focus on not so high energy dense foods, especially that are empty in your minerals and your vitamins. These includes, for example, your cool drinks, your cream sodas, your Cokes, who knows what. It can also include your chocolates, which are very high in sugar. It also includes your chips and crisps that we want to avoid. So if we focus on giving them, like I said, the well-balanced diet that includes a starch, that includes your vegetable and includes your protein, that alone will already help combat obesity quite a bit. we do want to recommend kids should be having snacks, but then it should be healthy snacks, focusing on fruits and vegetables, whole grain breads or brown breads even, low-fat dairy products, very good source of nutrition as well, and calcium these kids need.
Well, look, it seems like the parents and everyone watching today has got a task upon them to identify all the things that Monique has spoken about and make sure that they are on the kids' plate. And of course, it's not, you know, us telling you to go buy sushi for your child and all these sort of things. It's breaking it down to the bare basics, that you can go get some beans, you can go get some lentils, make sure that the child is getting the basics that they need so that whatever is in their diet is going to protect them against getting malnutrition. That was Monique, pediatric dietitian at the Chris Hani Baragwanath Academic Hospital. After a break, we'll speak to Zandile Kubega, Assistant Director in the Directorate of Child, Youth and School Health at the National Department of Health, and Marumo Sohobela, the Save the Children South Africa's Health and Nutrition Thematic Manager, about South Africa's burden on child malnutrition. Stay with us. Welcome back to Vital Signs. In the past 3 years, almost 3,000 children under the age of 5 have died of malnutrition in hospitals around South Africa. Now, these numbers were revealed to the National Assembly by the Department of Health, and experts said that families hit hard by the COVID-19 lockdown and poverty are battling to put food on the table. And of course, the situation is likely to get worse as more people sink into poverty with little sign of relief or economic upturn. Let's now welcome Zandile Kubega, who is the Assistant Director in the Directorate of Child, Youth and School Health at the National Department of Health, as well as Marumo Sohobela, the Save the Children South Africa's Health and Nutrition Thematic Manager. Thank you so much for both joining us.
Thank you.
Good.
Thank you.
Let's start off with you, Mr. Marumo. I want to get your feel when you hear a number such as 3,000 children have died in the country in such and such a time period. What does that mean for an organization like you?
Thank you, and good morning once again to your viewers at home. Those numbers are simply high. And as you have correctly articulated on the numbers, you see, South Africa is actually faced with what we would call a double burden of malnutrition. On the other hand, you've got 1 in 4 children that are simply stunted. Simply put, no access to food, which is a basic for all the children. And on the other hand, you've got 1 in 8 that are obese. These are, children that have got over access of the food that 1 in 4 would not have. So definitely that is a challenge. And as Save the Children South Africa, a child rights-based organization, what we live for on a daily basis is to make sure that every child's rights are upheld. Therefore, this is a challenge because right from the start, the right to healthy, nutritious food is being violated.
Now, an interesting thing when, you hear stats like that, and of course you look at this idea of what could be the cause of all these problems, is obviously something that always boils down to socio-economic sort of choices and causes that, affect all of this. Why is it such a big problem? Why are families struggling to feed the child a basic diet that would render them not malnourished?
Oh, thank you, Doc. I think, as it has been said already, there are many factors. Hunger, food insecurity, poverty within communities. You've spoken about the COVID-19 pandemic where people have lost jobs. They have no means or ways to really fend for their families. However, there are other factors ranging from lack of knowledge from caregivers to say even if you have the list that you might have, it might be in a form of a child support grant, because we know that some people basically live on child support grant. Some people basically live on a social relief for the distress, which is one of the safety nets from the Department of Social Development. So we need to get to a point where we get families to be resilient, families to be knowledgeable about coping strategies and mechanisms within these current trying times. We are looking at interventions that are more like empowering for people to be self-sustainable. Things like, starting your own food garden. It's some of the things that which we we are not so much inclined to use the little that we have to buying expensive complementary foods. So that is one aspect that which we can focus on. I would say those are some of the low-hanging fruits that which we can try and instill families to be on the know, to say, opposed to buying commercial products like bottled baby foods. It's quite expensive, and you might find that you get to feed the child only for a few days, and the rest of the month there's nothing. You have the issue around formula feeding or bottle feeding, wherein formula is quite expensive, wherein parents, if they are more knowledgeable or informed, to say if you breastfeed, it's also a family saving. It's also food security for your child. So those are some of the interventions that which we need to instill into communities to build resilience. Issues such as, you know, growing your own vegetables, issues such as starting your own chicken, growing your own chickens. It's something that which we need to really instill in families and teach families to say, rely on foods that are cooked from home. They are most likely to be more nutritious. They're most likely to be less expensive, because you can actually buy food from the local market. So that is one of the things that we want to instill families to be self-sufficient, to be resilient in the current trying times. And of course, the issues around economy, it's a broader discussion that we must have within the country to say, what is the role of the employment sector? What is the role of private sector in terms of creating jobs in order for people to be able to earn an income to raise a family? What is the role of agriculture in terms of the food value chain, empowering people to be able to plant their own gardens, or even subsidizing them to get seedlings that which they can plow within their family. So those are some of the things that which we think we can focus more attention on to try and curb the issue of malnutrition in the country.
Mrs. Hobela, let's talk about something that you mentioned a little bit earlier on, this idea that food security or food as a whole is a right. And by virtue of having so many children dying from severe acute malnutrition, that right is being violated. So as Save the Children, what's being done to address and make sure that this right is no longer something that is pushed to the side?
Thank you. Before I even get to that, I just want to make an indication that as we sit here and having a conversation right now, 30% of South African children live in households that have got no one working. And already starting from there, you would see that it will be difficult for communities and family members to put food on the table. And then what we do as Save the Children South Africa, we're saying to government, we're saying to civil society or organizations like ourselves, we're saying to communities, first and foremost, let's make sure that we uphold the rights of the children. Let's work with institutions like our early childhood care and development centers to make sure that the little that they're able to have on the table for the children that spend most of the time, the rest of the day with them, the combination of group of food that is given to them is good. You have heard from our dietitian earlier, as she was correctly, prescribing what is the content of a good food combination for the children. So as Save the Children, what we do when we work with our early childhood care and development centers, one of the center things that we look at is to make sure that the menu choices are correct, such that the children that spend most of their day within these centers, at least when they go home, they have had a benefit of receiving a nutritious meal. And in that way, we know that at least their future becomes secured. Because we are concerned as Save the Children that the burden of malnutrition on South African children has got much more ripple effects. In the first place, while children are not able to access nutritious meals, it also infringes on the second right, which is the right to education or the right to learning. Because we know from the literature that children that are malnourished have most difficulties in learning. Therefore, that's why we are concerned. And if children have had difficulties in learning, that also unfortunately has got a very long-term effect. They become unproductive adults. And when they become unproductive adults, the very same challenges that we see in the country of unemployment, poor food security, and so on continue. And the issue of crime also becomes perpetuated because it happened right at the beginning when children were still young.
Now, this issue of initiatives is an important one. I mean, Save the Children, being the organization that they are, many other civil society organizations that would want to triumph for the same thing, as well as government and all the initiatives that they put in place. are always working hard to put them out there to make sure that these children are fed. But when you hear a number like 3,000 children dying in a time period, that obviously still raises alarms to why are these initiatives still in place, yet we have such high numbers of deaths. What do you think is contributing to these deaths?
Okay. In terms of children who die after being diagnosed of malnutrition, the main key factor is late presentation within our primary healthcare facilities.
Okay.
You'll find that because of maybe lack of attendance to our routine primary healthcare services, you find that children end up, walking around with malnutrition. And we know that malnutrition doesn't happen overnight. You find that a child starts by being underweight. They lose weight. After that, they will be moderately, acutely malnourished, which is just wasting. And then the end part is severe wasting. So if we are able to identify children early, we're able to save them from deaths, because most of the children who present in a hospital or even primary health care facilities, they come with complications. You'll find that you'll find that already they have got, the doctor referred to the pedal edema or swelling on the feet. Those are some of the complications. Some are coming with a shakiness, what you call convulsions. Some are already vomiting everything. Some come with fast breathing. So those are some of the things that we want to try to alert parents to say, you know what, try and ensure that you attend routine primary health care services, because it is a way to try and pick up any problems that the child might be having, so that we are able to put them into care as soon as possible. So most children, often you'll find also that they will be losing weight, and then because they're not coming to the primary healthcare facilities, by the time they arrive at the they cannot swallow anything, they vomit everything, they have diarrhea. So those are some of the contributing factors to deaths. Most children will die of diarrhea with severe dehydration. So if you present late, you are most likely to die. But we want to acknowledge the role of our doctors in our public health facilities and the nurses, because they are still able to try and do all that they can to be able to save the child. We've got very good protocols in terms of managing even a child who comes with complications. But in some instances, they end up dying because maybe they presented too late. So what I would like to leave with our parents is to say, we have the Road 12 booklet. We have revised it several times to try and make it more user-friendly, to try and make it a health record that which mothers can also be able to use to refer to information that is on it. If you look at the back of this booklet, there are danger signs, that can actually alert the mother to say, if you see a child who vomits everything, a child with fast breathing, a child with swollen feet and ankles, that is an indication that you need to be rushing that child to the primary health care facility immediately if it's not within 24 hours. So we want the mothers to try and learn from this booklet, so that they can, take charge of their children's health. And then within this booklet, the dietitian spoke about foods that children need to eat.
Yes.
It's covered all in here. Mothers don't need to memorize everything. There is a diet plan or meal plan for children from 6 to 8 months, 9 to 12 months, and then from 5 years onwards, including the quantities, the types of foods, like different varieties of foods to suit someone with a low socio-economic income or someone with a high-end income. Everyone is able to make choices from this booklet. And then the other thing in this booklet, it's information on oral rehydration, children with diarrhea, because if a child starts having diarrhea at home, you need to know how to prepare that motswako, the oral rehydration solution. So all this information is here for mothers to be able to make use of. Other initiatives that we try and focus on is to screen even at a household level.
Okay.
Now community health workers will go house to house. They will be able to screen for malnutrition using the simple color-coded mock tapes. So what we want to also move towards is to train also mothers. There's a project that we are working on in 2 provinces, in KZN and Gauteng, to train mothers to be able to screen for malnutrition. The tape, you simply put it around the arm, and then where the color ends, it indicates to you whether the child has severe malnutrition, moderate, or they are normal. So it's something that mothers can look forward to, that would like to roll out in South Africa.
Mrs. Gobela, very quickly, we're almost out of time. I would just like to hear what you, as Save the Children South Africa, would like to ideally see happen so that the number of deaths from children with severe acute malnutrition is lowered significantly over the next 4 to 5 years, for instance.
Thank you. Firstly, Save the Children South Africa has got 3 breakthroughs. Firstly, we want to see that all children are able to survive. In other words, let's deal with the issues of malnutrition all at once. Let's make sure that they are able to learn. Let's also make sure that they are protected. Now, in order for us to achieve this, yes, we acknowledge there are a number of causes of malnutrition as we be speaking right now. One, poverty is one of the factors. Income inequality also comes into play. You also have issues of inadequate or poor breastfeeding practices, which the department, Dr. Mungeni has articulated very well right at the beginning, that let's go back and make sure that we practice proper infant and young child feeding. But then over and above that, let's make sure that all of us that are involved, we come together in communities and let's go back to the basics and make sure that we take care of the vulnerable who are our young children. Because like I have said, the impact goes long. We might be looking at this child now, but then 20 years later, when this child is an adult,
Mr. Sohobela, I'm going to have to jump in there. I think you have made your point, and I think we all need to take it upon ourselves to really step up what we are saying we're here to do, and that's, of course, to look out for the children. Thank you so much for joining us today, and thank you to you, Zandile, for joining us today, and, of course, all the guests that took part in the show. Look out for the children and make sure that they're protected and fed at all times. From us here at the Vital Signs team, thank you very much. We'll see you soon.